Today we'll be talking about a test that is often recommended for pregnant women over the age of 35, and it is called amniocentesis. Amniocentesis can be recommended for pregnant women who are at higher risk of having a child with genetic or chromosomal abnormalities. This may include women over the age of 35 or those with a family history of genetic conditions. So one of the main reasons for this test is to detect genetic and chromosomal abnormalities like Down syndrome, Edwards syndrome, Patau syndrome, or neural tube defects. This test can also be advised when, for example, a previous prenatal screening has shown a potential problem. So amniocentesis can be done to get a definitive diagnosis. The test can also be recommended to you if you wish to have more information about the health of your pregnancy. I was also offered to take the test by my obstetrician when I was around 16 weeks pregnant, and I was at the time 33 years old. I refused to take it because my regular checkups had shown no concerning issues, and I was told that my pregnancy was going well, so I decided not to take it. It is also important to note that in some cases, the results of amniocentesis may lead to decisions about the continuation or termination of the pregnancy. It is, of course, a deeply personal choice. When genetic or chromosomal abnormalities are detected early in pregnancy, it gives parents a chance to make informed decisions about their pregnancy. And if a decision is made to continue with the pregnancy, it gives them a chance to prepare emotionally, mentally, and financially for the potential medical needs of their child. And it also allows doctors to prepare for any necessary medical interventions or specialized care that the newborn may require immediately after birth. Okay, now let's talk about the procedure itself. Amniocentesis is a medical procedure in which a thin hollow needle is inserted through the abdominal wall into the amniotic sac surrounding the fetus. This procedure is performed between 15th and 20th pregnancy weeks to collect a sample of the amniotic fluid, because this fluid contains cells that are shed by the fetus, which can then be analyzed for genetic conditions. Amniocentesis is typically not done under general anesthesia because it is considered a minimally invasive procedure. However, it is usually performed with the use of local anesthesia or a numbing agent to reduce discomfort and pain at the site where the needle is inserted. The doctor can use ultrasound to check for the best location for inserting the needle. Obviously, the needle is carefully guided into the amniotic sac away from the fetus, and then a small amniotic fluid, usually around 20 millimeters, is withdrawn through the needle and collected for analysis. After the procedure, the needle is removed and the pregnant woman is monitored for a short period of time to ensure that there are no complications. The use of local anesthesia helps, of course, to minimize pain and discomfort during and after the procedure. Some people may experience mild cramping or discomfort, but these sensations are generally temporary. It is important to note that you should discuss this procedure with your doctor, both the anesthesia and the process itself, and to make sure that you are well informed and comfortable with the process. And also know that amniocentesis is an optional test, and you decide whether or not to undergo it based on your specific circumstances, medical history, and personal beliefs. And of course, discuss it with your doctor to make an informed choice. All right, that is it for today, and see you next time.